and welcome to this installment of Frank and Mary here on Nantucket. This is the COVID-19 version. As you can see, Frank and Mary are dutifully wearing their masks, although I'm not, because I'm totally alone here where I am. You know that this show is not about elder law, although that's kind of what I do for a living at Myrick O'Connell. It's really about Frank and Mary and how, in general, they can live in their house until they die. And their goal right now is to just survive because of COVID-19. And they're kind of stuck in their house by themselves. And so there are a lot of questions that they've got and that I'm sure that you've got. So you kind of all know Allison Forsgren. It seems that everybody I bump into knows Allison. And she is my co-host who would agree to do these shows with me, you know, in order to really kind of reach out to what we thought were the right people at the right time. And so, Allison, you've got some great guests today, although I know that I have met both of them, and Taylor Hilst, back when she was a nobody back at our island home, had been our guest several times, and now she's a big-time person. And I had met Roberto before, but if you could introduce our folks, and then we're just going to talk about Frank and Mary and everybody else on Nantucket and COVID-19.
So today we have two people who from the town of Nantucket staff who has been working, the administration, who has been working really hard in these new times. We have Roberto Santamaría, who's the health director, and Taylor Hilst, who is the human services director. And they have both been more than just busy over the last month plus. So first of all, can you tell us how you're doing?
Oh boy. So I guess I'll go ahead and start. It's been, we like to joke about how it's been 36 days in the bunker. We call it the bunker. It's the Emergency Operations Center located over at the police station. Since March 11th, we've been in there every day, monitoring the situation, monitoring all the shelter-in-place orders, all the emergency orders. It's been difficult. But the numbers don't lie. We've been holding fast at 10 cases for the last 11 days, and we're hoping to keep that number down. So we've been doing well. It's a lot of work, but we wouldn't be able to do what we're doing without all our staff, the work, people like Taylor, and then the island residents really have chipped in and have really jumped in with both feet to protect everyone else. We should really applaud ourselves.
I mean, I think it's outstanding that things have been kept at bay. So I think your guidance and people listening has been a real credit to the island. So, and so Taylor, how are you doing?
Hi, Allison. I'm doing well. Has been, an interesting, obviously, change and shift for everybody. Pertaining to work, I was relatively new in the position when the kind of whole world turned on its head. So that has been an adjustment, but I feel very fortunate to be in a position where I get to be in a helping role and working on programs that help people, survive through this time. So really, I just feel very grateful to be in this role, and I'm, happy to take it on and happy to do it regardless of how busy it's gotten. It's a good fit. I'm very happy. So in that way, I'm great. Thank you for checking.
Wonderful, wonderful. So I'm wondering, we asked seniors just yesterday to get back to us with questions because we thought this was a really timely matter, and we didn't get very many direct questions, but I'm sure you have a lot to share. What are some of the most important things that everybody, but seniors in particular, should be doing right now?
Taylor, you want to start on that one?
Allison and Arthur, I'm so glad that you guys had us on today because I believe that you can help us reach some of our seniors that might not have access or awareness to the programming that we're running to help them with their stay-at-home plan. These days, not everybody is on social media or already involved with Salt Marsh Center. So thank you so much for helping us spread the word. The best thing that people can be doing right now is staying home. Obviously, 2020 year of the senior has become more about safety right now than about celebration. And we will celebrate when we can. We will get there eventually. But for now, it's about staying home and it's about staying safe. One new program that we're running through the Salt Marsh Senior Center is called Senior Meal Delivery. It's totally separate from Meals on Wheels. That continues to function as it always has, but you do need to qualify into that programming. For us, essentially to receive a free meal 5 nights a week on Nantucket, all you need to do is be over 60, be living at home, and not already enrolled in Meals on Wheels. So this is a program that Salt Marsh started in partnership with the owners of Sandbar / or The Whale. Initially, they were just doing it entirely out of their own generosity, which is just incredible. And we now have grant funding for it through the Community Foundation. So we intended to run it through April 10th, but now we have extended it indefinitely thanks to the Community Foundation. So we're extremely excited about that. If anybody is living at home and would like a meal, and they're absolutely beautiful, all you need to do is call the Salt Marsh Center between 9 and noon, Monday through Friday, and get signed up, and it will be dropped off at your home. Totally no contact delivery by volunteers.
And so Taylor, Taylor, how many people are participating in that? I know a lot of people
It's a lot.
Qualify, so.
Yeah, the qualifications are really broad, so it's open to anybody over 60. I think we started out high 40s. I believe our biggest night thus far has been high 70s. It's a lot. As of today, after this films, we'll probably have delivered over 1,000 meals, but we can grow it more. So don't be afraid to sign up, seniors out there who are watching this. We want you to stay home. We know that it's not always feasible to cook, or you don't want to go to the store. We don't want you in the store very often. We want to get you this food. So I would really encourage anybody who's interested to try it. You don't have to do it 5 days a week, but you're more than welcome to. We do ask that people call every day because we go over food restrictions and allergies every time. The menu is constantly changing. So you can't just call and say, hey, sign me up, for the rest of the time that you run this program. We do ask that people call every day, but that's really our only restriction.
And so what is the phone number to call, Taylor?
It's 508-228-4490. And while you're at it, as long as you're on the phone with Laura Stewart, who's the staff person who is still at Salt Marsh right now, even though we're closed for senior activities, if people are interested, they can get signed up to receive very frequent communications from us. We send out a ton of updates through a program called Constant Contact. So we do the constantly updating health resources, fun things to watch or do. We've done some direct product distribution of kind of scarce items like masks, and toilet paper in particular can be very hard to come by right now. We send out virtual cards and pictures from students. It's a great thing to get signed up with. So anyone who wants a meal or just wants someone to talk to can call in. Another thing that we're offering to help people with their stay-at-home plan, this isn't kind of on the hierarchy of survival, but we know that isolating is one of the worst things that seniors can do. It's what we say don't do. We're like, come, be involved, don't be alone. But that's what everyone needs to be doing right now. So to help with that, we do offer a social volunteer program where people can spend social time on the phone with a volunteer, and it can be large chunks of time. Saltmarsh staff does call and check in with people. We take phone calls and can help problem solve. But for someone who wants more contact, which I would imagine that a lot of people, especially those who are living alone, might want, we have volunteers that can spend a good deal of time on the phone with people, and also people that can read to seniors who might be sight impaired. It would be very difficult to be home alone right now and not have good eyesight. So if you want a book, an article, something on the internet read to you, we have volunteers who can do that. Most of them are actually library volunteers that I know from my time from when I was the OIH activities director, and we ran an in-person group kind of similar to what I'm describing. So I would love, love, love to get more people signed up for that. I think long term, as this goes on, that could be something that could be really beneficial to people who are very isolated without a family at home.
Taylor, can I ask, so did that piece of this program just evolve as a result of this COVID-19 thing? Because that's just
correct.
remarkable.
Correct.
That's a remarkable thing.
Saltmarsh's motto has been, let's get people in together. Social, we can't do that right now,
right.
But we want to offer as much virtual contact as we can. And the phone piece is really good for people who might not be computer savvy.
Right, because it just strikes me that, well, when you talk about the participation specifically of the library, when we talk about the good news about COVID-19, boy, now this is a small topic.
It's small.
It's the change in reality that you start seeing may be there as a result of this. And I think specifically this notion of being able, when you just described the notion of having somebody that could actually read to a senior or for somebody who has difficulty reading, right? Even like some of the newspaper, just to kind of keep up and literally can't be there. And I think specifically when I talk to other folks who are doing it, senior center directors right now, I talked to a woman recently, and I said, so what are you hearing, among other senior center directors and blah, 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 and, she said, well, some of us, we were talking to a group from the statewide organization who was talking about, there may be some soft openings at senior centers like in September. I was like, September? Now, once again, that's all discussions among senior center directors, but it could be a long time because of the vulnerability of that population. So having this stuff that has evolved specifically during this broad stay-at-home time, really, you could really see, kind of continuing. It's wonderful. It's wonderful.
Yeah.
Now, Allison, can I ask Roberto a question? I'm sorry. So can you tell me, and I think folks, once again, who are nervous about this would be interested, you said there are 10 cases at this point in Nantucket, right? So how does someone who has reported positive ever get off that list? So do you come off if you've been reported positive, you've self-quarantined, it's 14 days, and somebody says, hey, how you feel? You're like, okay, how does that happen, and how do you kind of figure all that out so that people know what the level of kind of people feel a danger out there? What is that?
No, absolutely. So actually yesterday, the hospital started reporting, added 2 extra rows in their reporting that says recovered, because as people recover, they're going to be entering the workforce. They're going to be going back into the public. What's happening is when somebody gets found to be positive, and if they're healthy enough to isolate and quarantine at home, they would do. But then they do a daily check-in with either their primary care or some of their nursing staff, and they monitor symptoms, everything from temperature to lung capacity. Sometimes they have a little spirometer that they're using, and then in the event that it becomes too severe, then they go into the hospital. If they start feeling better, then as that symptom monitoring continues, if they get good enough that they get to the all clear side, then they get an all clear from their doctor. Usually they come in for a final checkup, And then in that final checkup, they get that little, little piece of paper that says you're good to go back to work, or you're good to go back. You're no longer showing any of the signs and symptoms. So we're already seeing 6 recovered, according to the hospital data released yesterday. So that's a very good number. That's a very good number. We've been seeing some of the cases nationwide where some people are showing symptoms for only about 6 days, to some people are showing symptoms all the way up to about 4 weeks. It just depends on everyone's individual immune system. So it just requires daily monitoring.
So just as a follow-up question, so you were talking about that number 10, there are 10 cases. So does that 10 reported cases include people who now, according to this new list, you would say they had it, but they've recovered?
Yes. So the way we do it, once we have the 10 positive, we have to maintain that 10 positive. We have to say that there were 10, it's called an incident rate. So we have 10 incidences of coronavirus, even though 6 of them have already recovered.
I see. Thank you. That's really helpful. I think it might be helpful for people to just get a sense of, once again, as a result of everything they've done, how positive, things are.
Absolutely.
All right, I have a couple of questions, especially for people who live alone and are seniors who have friends that are all healthy and not showing symptoms. When can you start having someone over to dinner, or when can you ride in the same car with someone if you're 6 feet apart and you're wearing a mask? I mean, how do we get people face to face with people safely?
Oh boy, that's a tough one. So I don't know if you saw the Harvard epidemiologist yesterday on Fox and CNN. He was on both. His most recent data is showing that until a vaccine is found, we may be practicing social distancing measures well into 2022. It is the problem with the coronavirus, this version of the coronavirus, because coronavirus is a family of viruses. It's really important to understand that even the common cold is a type of coronavirus. This just happens to be a much stronger version of a coronavirus that we haven't seen before. And as a result of that, because it creates a severe respiratory illness, that we may be at least 12 months to about 18 months before we even see a vaccine. The problem with vaccine creation is that we can't just rush it to market. It has to go through all the animal models to make sure it's safe before we even test it on humans. So we may be going back to, quote, normal, starting next month or so. But when we say normal, that means, we're at least getting the economy back up and running, but with still some strict social distancing measures. Maybe even wearing cloth masks out in public. The other issue with this virus is that we're going to start, until a vaccine is created, we're going to start seeing it rear its head every cold and flu season. So every year it's going to be coming back, but we can't afford to go into a lockdown every time. So social distancing measures are going to be basically the new normal until we issue a vaccine, until we can find a cure for this. It's a very tough decision of when we can go back to that new normal. We're working with the state and the federal authorities on that to find out what the best date is. Charlie Baker has joined the New England Consortium of Governors on when to reopen the states to minimize economic impact. But when you say, when can we go back to normal, the answer might actually be never. We might be in this virus has changed the face of the earth forever. And in some ways, like we were just mentioning earlier, in some ways for the better. Through this, we have seen innovation and a community coming together that we have never seen before. And that is something to be applauded. But as far as social distancing, we may be down to fist bumps, high fives at the most, and say just at least for the foreseeable future.
And so say like you want to visit your parent, and you live in Connecticut and your parents are retired here, and you want to come and visit. How would that work?
Once everything is back up and running, definitely you can come visit. You can come to Nantucket. You can go to Connecticut. You can go to New York. All the locations. Just make sure that when you go do visit, that the person who is visiting, whether the host or the guest, isn't feeling any of the symptoms, or they have properly screened themselves. That they don't have a fever, they don't have a headache. Because it's really important to understand that you can be shedding the virus without even knowing you have it. So you just have to take proper precautions. But we're not saying that you can't visit once the shelter-in-places have been lifted, the stay-at-home orders.
Excellent. Now, I'm wondering, we had a guest on the show. I'm not sure if it has aired yet, but there's a group called nantucketneighbor.com, and they run a Slack channel, which is a way to communicate with a lot of volunteers, and are prepared to do many things to help people. Is that a service that you've seen utilized, and is there any way you can help get that word out to frail elders or just senior citizens, so that they can avail themselves of some of the things that need getting done?
What we've been seeing is that they've done a great job at getting that information out. I think it's a great service that they're providing to the community. I think it's really good at what they're doing. As far as the town goes, the reason the town hasn't sponsored that program is mainly because there are specific rules and regulations that we have to go through, everything from certain types of background checks and things like that. And with the shutdown that's happening, we actually can't even perform some of those duties unless it's for an emergency. So we do applaud the work that Good Neighbor is doing. And I believe it was a program that Grant Sanders was working to coordinate. And I think Grant is doing an amazing thing for the community. It's part of that innovation that I was talking about earlier. And I really hope that we can get that information out too. And they're doing a great job at gathering the volunteers. And from what I'm hearing is people are availing themselves of that opportunity. I hope that we can get more information. This group, you two, Frank and Mary, have been doing really great at getting that information out, and we really appreciate it. I think Grant.
I know that there is, you could connect with them only online. So
Yes.
I think that if you get someone who can email them or something like that, you can get access. But it would be great to collaborate and get some phone number that could be distributed and shared with people. I mean, they don't have the manpower to do that at this point, because it is all volunteer. But going forward, that's a great model to have in place, and it's similar to Village to Village or some other programs in communities like Falmouth Together. There are so it would be great to get that program to continue. So Taylor, the news of senior living complexes and assisted living and skilled nursing fatalities nationwide is frightening. And I know our population here on Nantucket is, there are several, living situations where people share common space. Can you tell us first how our island home is doing as far as infections and spirits and staff, and then update us on the rest of the places?
Absolutely. Our island home is in a very good position right now. And actually, though it's extremely unfortunate that it needed to be sealed off to visitors and volunteers, we actually were ahead of the curve on that per guidelines, much like all of Nantucket, thanks to the direction of Roberto and the people that he's working with. And that could be why OIH is in such a good place. Healthy, and actually from what I hear morale's quite good given the circumstances. Specifically, though, of course, it's extremely difficult not to have our volunteers, not to have family members come in and visit. And that's a huge sacrifice on the part of the people who have family members in OIH to not be able to see them, but through the window. Our new activities director who replaced me over there, Ali Rowell, has been doing an amazing job modifying things to keep the spirits of the residents up. We've done Zoom concerts. One of our most wonderful group, which is a reading play group, has also been offered via Zoom, where we have a volunteer Zoom in and read storybooks to little kids that are also Zoomed in, and the residents can watch. It's unbelievably sweet. So things still are happening. It's had to shift. We also accept virtual cards and pictures from kids that go up on a big bulletin board for all of the residents, kind of like a not an in-person, but a physical version of what I described that we send out to the Salt Marsh residents. And actually the response has been so great that they had to double up the boards. So that's really wonderful. You can also reach out to the activities director if you have a friend or family member in our island home and they do Zoom and FaceTime with the residents, with their families, so they still can see each other, if not in person. And she's also modified other favorite activities. For example, bingo. They've been able to do kind of distance bingo with assistance, putting it up on the big screen so that people can be far apart and still playing. And I know that she put in requests to Friends of Our Island Home for other games that will allow people to kind of play together, but far enough apart where it's safe. So she's just done a really amazing job. It really is like a home in there. And even though it's incredibly sad that friends and family can't go in and that they are more isolated than ever, actually they all have each other. So all of those staff and residents, they're actually in some ways less isolated than the rest of us because there are so many people that they're seeing each day. So OIH has just done an incredible job staying healthy and staying safe. And our other senior living environments across the island have done a wonderful job as well. They've all reported in their policies and procedures for keeping their residents safe and have taken feedback. So we're just, we're really impressed. Thanks to kind of, stringent isn't usually a positive word, but thanks to how, stringent and seriously our town has taken this, I think we're in a really good position. Seniors included, as hard as this is and as much sacrifice as it's taking.
So could I ask both of you, Taylor and Roberto, could I ask you, this has been a great show. I remember we were talking about this show and of course, Taylor was saying, but what are we going to talk about? And we're like, well, Taylor, this is no problem, right? So could I ask you each, if you were 30 seconds, a final piece of advice? Oh, excuse me. Taylor, I also want you, if you remember, do you remember the phone number, your old phone number, which people could call if they wanted to talk to the activities director? If not, we'll put that in later and we'll just. Mm-hmm. But then I think you each to just a final word of advice for folks. We know we're kind of in the middle of still kind of a tough period for what's the best thing to do right now?
Stay home, stay safe, and take advantage of the resources, which hopefully some people learned about some new resources today that they aren't already aware of. And if you do want to get in touch with the OIH Activities Director, it's 508-228-0462, extension 6.
You remembered. Roberto, advice from the health director.
I think just to echo everything Taylor just said, stay home, stay safe. I think make yourself available to these technologies. Zoom is a great way of connecting with friends. And we've been really fortunate that we live in the time that we do, where we have this understanding on how to be close to each other, even through distance. Enjoy Nantucket for the reason that people come here for the summer. You are still allowed to go outside and enjoy this beautiful weather when we get it.
Thank you. Allison, thanks for putting this together. And of course, you always have the greatest guests. So this is a lot of fun. Thank you both to our guests, and thank you all for watching. I think this is really important. We're really trying to provide this as a mechanism, as Taylor has suggested, for folks who really need this information. And we'll look forward to seeing you on the next installment of Frank and Mary, the COVID-19 on Nantucket, the COVID-19 version. Wear your masks. Frank and Mary do. Thanks.
All right. Thank you, Arthur.
Thank you, guys.
Thank you.